So you or your child has been diagnosed with otitis media, or an inner ear infection. Here's what you need to know and a bit of what you might like to know. So we get an inner ear infection when there's bacteria inside the inner ear. The tube that actually leads from the inner ear actually goes to the back of the throat. So normally that allows drainage. And in adults that tube is quite big, but in children the tube is quite small. Not only is it small, but it's also quite horizontal. As we age, it becomes more vertical so that drainage can happen better. Now, most commonly, your child gets a cold, just a viral infection with a runny nose and a cough, and that causes inflammation to that small tube that's actually quite flat. And with that inflammation and it being flat, the tube becomes blocked off. Once the tube is blocked and can't drain anymore, it's a nice warm place for bacteria to come in and grow and multiply, and that's your inner ear infection, also called an otitis media. Patients often complain of ear pain or decreased hearing. That's not surprising. The physician will look in the ear and decide whether or not it looks infected, and if it is, they will likely give you some antibiotics. Do take them as soon as possible and take them as directed. I know that's very difficult with a small child. I have them myself, but if it's 3 times a day, do take it 3 times a day. Otherwise, you're allowing the bacteria to increase in their level, and then you'll try and get them down again, and they come up again when you're missing doses. So try and take them as directed and never stop early. You want to take the whole course, even if you're feeling better, if it's your ear infection, or if your child's looking a lot better. Don't stop early. Finish the whole bottle of antibiotic. Otherwise, you're promoting bacterial resistance. You can also take acetaminophen, which is the same thing as Tylenol, or ibuprofen, which is the same thing as Advil or Motrin, for pain. That's just fine to take. And you also want to avoid taking any flights during this time, at least for the first 2 days of antibiotics. It's going to be very painful for you or your child if you have an inner ear infection and you're going up on a plane at high altitudes. So try to avoid that if you possibly can. You should follow up with your family doctor or physician within about 1 week to see that everything's improving. Reasons to return to the emergency room include worsening fluid coming out of your ear canal. If you develop a seizure, I think you would probably come back to the emergency room anyway if you developed a seizure, or your child. Or if you're becoming more drowsy, confused, or develop a stiff neck, or your child is. Those are reasons to come back to the emergency room. I'm Dr. Atzema, and those are my discharge instructions for otitis media, or inner ear infection.